toy? You want your toy? You want your toy? Ow! Oh! Oh, my back! Oh, my back! Oh, my back! Hey, what's up everybody? Welcome back to the Move Better channel. I am your host, Dr. Joe. Today we are going to be talking about acute low back pain. Some of the things that may happen is you might just be reaching for something off the ground. If you're a lifter, you might be lifting something off the ground, and there might be some deficiencies within your movement patterns that all of a sudden cause these injuries. And so what are we going to do about it? And the first things that a lot of people start to do is they start to roll out, they start to stretch it out, and I'm going to let you guys know right now, it might actually be hurting you guys more to do that. A lot of the times you create this false sense of security for that injury, and that's not something that you want. When I say false sense of security, your body will feel good for a very quick second, and as soon as you start moving, as soon as you start trying to do what you normally do or your daily tasks, you injure yourself right again, okay? And those are the things that we want to try to limit. We want to try to protect the injury whenever that happens. If there's an injury that happens immediately to that lower back, we want to try to figure out why it happened in the first place. So first things first, what happens when you do pull a back, when you do strain your back, right? But a lot of the times what happens is all those muscles that are trying to protect your lower back, all of your core muscles, they try to stabilize your spine. The purpose of what they do is they try to hold this thing in place, right? And if they're trying to make sure that they protect this area, and all of a sudden there's a quick injury, maybe to like a disc or a capsule in this area, capsules are normally the things that kind of hold these joints together to help them glide, to help them move, to protect them as well. If there's an injury to any of those things, we can call that a strain sprain, right? And that's when the muscles start to spasm. And when the muscles start to spasm, they try to protect it even more. So what we want to do is we want to try to, instead of stretching those spasms out, because it's so tempting to try to get into rolling it out, massaging it, stretching it out, because in essence, those muscles are trying to pull together so much and we're trying to relax it, right? However, the goal is to try to give what it needs, is trying to help the spasm out, trying to get into the contraction. So what I'm going to do is I'm going to teach you guys some exercises that you guys are going to be able to do to be able to contract and pull those muscles back together again. First things first is what not to do. And a lot of the times I see people doing this, bringing your knees into your chest. Go ahead and bring both knees into your chest. And they say, stretch your back. Go ahead and hold those knees. How often have we seen people do this, right? Oh, just stretch your lower back. And then they start rocking and they start bouncing here. That actually might create more pain. What that does is if there's a disc herniation and it's going posterior, if it's going out the backside and I create more flexion, well, guess what? That disc is going to push out even further posterior, further back, which is going to create more and more pain for the patient or more and more pain for you. So do not do this. Another thing I see a lot of people doing is they'll go right into stretching out their butt cheeks, their glutes. If you stretch out your glutes and they start doing this, that's a good stretch. That's fine. However, if you have an acute low back pain, this is not the way to go. We need to stabilize the injury, and that's what we're going to get into next. We're going to get into strengthening the lower back and just doing very, very simple movements to keep yourself from getting into that pain or that muscle spasm pain. The first thing that happens when you're injured is those muscles start to spasm out, right? And if those muscles are trying to spasm, we don't want to stretch it. We don't want to pull them apart. We don't want to foam roll it. We don't want to massage it out, because if we do that, it might create more of a spasm later on. And when that pain comes back with a vengeance, you're going to be in a lot of pain and it might take longer for you to heal. So we don't want to overly stretch that. We want to actually fatigue the muscle. So we want to push into the contraction of the muscle or the spasm. So in this case, I'm going to have him lay face down for me, please. We're going to do we're going to do some crocodile breathing in this stand from this point. And you're just going to see how this feels. I'm going to have his head face down, his forehead against the table, or in your case, your forehead against the ground. I don't want you to do this on the bed. I want you to do this somewhere where it's nice and hard and stable, okay? And this table right here is pretty sturdy, and so he doesn't necessarily sink in. First thing I want you to feel when you're in this position is I want to see how your pain is doing. Is it manageable? Are you relaxing into this? Are you able to breathe, first of all, through your nose and your mouth because you're in this position? Make sure your forehead is down and your chin is tucked. So that way you can still have air and passageway from your nose and your mouth. And when you do that, you're actually stretching out some parts of the muscles in the neck, and you're actually activating the top part of the neck. And in this case, the spine and the lower part of the back is now working on extension just by you laying down on the floor here. Now, one of the things that we want to see is the tolerance. Are you able to tolerate this? Now, a lot of people, 90% of the people that have low back pain, especially from picking something up or a disc injury, this position feels the best, not necessarily laying down on their lower back. Because if you start all of a sudden twisting your hips from from laying down on your back, you might create another spasm in that position. So try this position out first. This will help level out your spine. From this point, you're going to try to take deep belly breaths. And those belly breaths are going to go all the way down into your pelvic floor. And if you don't know where your pelvic floor is below your below your belly button. And so you're going to breathe into this lower part of your area or lower part of your abdomen. And in his case, I'm going to push right into it, and I want you to breathe right through there. Inhale. Exhale. And this is called crocodile breathing. We want to get our patients to work on the breathing techniques because this will help determine how well their spine is being stabilized by their core. Now, next thing I want to have him do is if this starts to feel good for you, the next thing I'm going to have him do is I'm going to have him place his hands right next to his chest with his hands, his thumbs, right across the nipple line of his chest. Now, as he's here, notice where his elbows are. It's nice and tight. He's pinching his shoulder blades back as he's in this position, and already, just minuscule, we're starting to get a little bit off of the floor, and the muscles of his mid-back are starting to activate. They're starting to contract. Those muscles will help to decompress the spine. We want to do these spinal extension exercises. We don't want to get too intense with them just yet because we don't want to overly stress out our body. And in our case right now, this is kind of a stretch for his lower back. And in actuality, you're not really stretching your lower back. You're activating the muscles of that spine to help pick you up and help decrease that herniation. So as I lift that, as I have him push into his hands, he's going to lift his chest about an inch off the floor. That's all I'm going to do. And at that point, he's going to relax his butt muscles. He's going to relax his toes. Those are key points right there. Relax your butt muscles, relax your toes so you don't have too much activation of that lower spine. Then what I'm going to have him do, he's going to hold that for about a minute or two. It's going to burn out. That's kind of what I want you to do. Burn out a little bit. Let your body work. Let yourself sweat a little bit just to try to get those muscles to start to relax. Then what we're going to do is we're going to place our hands a little bit higher here. And as his hands are a little bit higher, his elbows are around a 45-degree angle. His hands now, his thumbs are right around his cheeks, right around his ears. And next thing I'm going to have him do is I'm just going to have him lift a little bit higher here. And this is just going to make it a little bit harder. It's going to put a little bit more pressure onto the shoulders. We don't want to bring our elbows out too far because we don't want to strain our AC joints. Next, we're going to keep just pressure into the bottom part of our ribs. So as he's pushing up, his ribs are pushing down. And that's actually going to help decompress that lower spine, actually stretch out that front part of his spine so that way the disc kind of gets reabsorbed and being pushed back, okay? Next thing I'm going to do is I'm just going to make it harder because we don't want to adapt to an easy exercise like this, right? So we want to make it harder. And in this set, we're going to do the first set with his hands next to his chest, second set with his hands next to his cheeks, his ears. Bring your hands up even further here. And in the third set, we're still raising that nipple line off the ground. His hands are just further out, and we're trying to pull his shoulder blades away from each other while pushing down on his elbows and his hands. And now his hands are a little bit off of the table, but in your case, you're going to be on a floor, so your hands, you want to be able to communicate your hands to that floor still. He's pushing down on those hands. He's trying to activate the sensory information from his fingers as he's pushing up. Now, as he's pushing up here, he'll notice, do you notice this, that the pressure goes higher on the spine here? We go higher on the spine and less pressure onto that lower back, so that way these posture muscles actually starts helping to decompress that spine. Now again, This third set, he's holding that for about a minute. After we do that, go ahead and take a break, relax, rest it up. Do that again for about 2 to 3 more sets, which means you're going to be on the ground for about 10 minutes or so just trying to get your back to stabilize. Do this over and over again until that lower back pain starts to go away. Now, one of the things about lower back pain is you'll start to see this hip intalgia, right? If there's a disc issue, if there's a disc herniation that's happening, one of the things that our body tends to do is they try to lean away from that area of pain, which is a natural response. So don't get too freaked out about it. I get a lot of patients that come in here and they go, why do I stand like this? Am I going to stand like this forever? One of the things that they see is this. So your body tries to lean away and then all of a sudden your ribs are shifted over, your posture looks completely different, and your hips are translated to the opposite side. What that means is, in this case, my disc is most likely on the right side. And if I'm leaning away, if my upper body is leaning away from that, my hips are going to kind of shift over into that position. So one of the things I want to teach you guys on how to fix that and how the hips may actually help decrease that pain as well as decompress that disc is we're just going to get you into a loaded position. Now, as I said before, we want to try to extend that back. We want to create a decompression. We want to try to stretch out those muscles of the anterior side, the front side of our body, and we want to try to activate the muscles in the back side of the body. So what I'm going to have him do is I'm going to have you get on up real quick. You're going to kneel down for me, Matt. And as Matt's kneeling down right here, first thing that we start to feel is that how weak our glutes, how weak our posterior chain is, our hamstrings, our butt muscles, our lower back, and our mid back. In this case, I'm just cutting the knees out from under him. When I do that, it allows the big, thicker muscles of his butt muscles, of his glutes, to start to activate to help and force stabilization of his hips. When we have what we call regional interdependence, when we have the dependence of the hips doing what it needs to do, the lower back doesn't have to do the work for the hips anymore. So in this case, we're just trying to stabilize the hips by squeezing his butt muscles. Now squeeze your glutes here. And if you squeeze your glutes good enough, what you're going to start to feel is you're going to start to feel a stretch on the front part of your hips. Can you feel the stretch there? So squeeze the glutes, and a lot of the time I tell my patients, squeeze your butt muscles, push your hips forward slightly. There you go. So you don't have to necessarily rock yourself to where you're jamming the joints and the discs in the back here. You're just trying to sit up straight. You're squeezing your glutes. You're feeling a little bit of a stretch in the front part of your hips here. And as you're there, you're trying to feel how your body, your hips, are starting to realign back into place. Now, how long do we have to sit here? Sometimes I sit there for about 3 to 5 minutes if I've injured my back. Or if somebody has injured their back, I have them sit here for quite a while because it takes time for our body to realize stabilization. It takes time for our body to decrease pain. When I said isometrics in the past, isometrics is there's no change. All we're doing is sitting in one place. We're not creating a contraction of the muscle too much. We're not releasing or extending the muscle. And in this case, he's just kneeling down. And as he kneels down, we're activating our core. And from here, when I say activation of the core, I'm not having him flex his spine. Sometimes flexing and bracing that core might add injury, might add more pain to the injury. So what I want him to do simply is just breathe normally. And as I was teaching you guys about that crocodile breathing, where he's breathing in and out of his stomach here, he's doing the same thing. Now, in a pain response or in a brand new injury, his ribs might be flaring, right? He might be breathing too much from here. So I want you to just place your hand on your chest here. And as you're breathing, try not to let your hands rise and fall. There you go. You see that big pregnant belly? That's what you want to see. You want to see the belly come in and out, right? And you want to breathe, what I said before, underneath your belly button. Breathe low. When you can breathe low there, now we're trying to get all of the muscles to start to activate. And those muscles need to do what they need to do. The lower back stabilizer, spine stabilizer muscles will do and be forced to work on stabilizing that spine, which ultimately creates decompression of that, okay? The next thing that you're gonna do is depending on where that hip hinge is. If I'm doing this and my hinge is over to my right side, I'm gonna keep that right knee down. Now, this is where it might get a little confusing for you guys, but if I were the wall next to Matt here, and his right hip was the one shifted over. Do you want to actually face this way, please?
Sure.
Okay, move back on this table slightly. Yep. Okay, and in this case, let's say his hip was actually shifted over this way. Well, what I want to do is, because that butt muscle, the glute med on this side, is not firing the way it needs to, and it's actually dropping here on this side, what we're going to do is we're going to bring that hip back into neutral. We're going to bring that left leg out, because the right side is the one that's antalgia. The right side is the one where the hip is shifted. His body is shifted over towards the left, where his right hip is shifted over towards the right. We're going to try to get that muscle to activate and pull back. And so what I want to do is get those glute muscles, those butt muscles, to fire on his right side. And notice how far his hips are, right, or his feet are. This is going to make it easier for him to shift over. So you're going to have to align your foot right in front of that knee right there. Perfect. And notice where where he's at. His instep of his foot is on the inside part of his knee. You just kneel right here and you squeeze those butt muscles. Now, if you need something to help you up, like a cane or a broomstick or anything, or even a bed, if you're kneeling down next to your bed and you're just holding on, all you're going to do is just work on squeezing your butt muscles while, let's say my hand is the bed. You're just holding onto here, squeezing the butt muscle, lifting the ribs and extending back here, and pushing that hip back into place. And again, isometric. Sit there for about 2 to 5 minutes. Feel that butt muscle start to burn. After it burns, after you're completely exhausted, slowly get up and try to walk around and see how much change has just happened there. All right, to wrap it up, you guys, just to understand, if you were lifting something from the floor and just straining that lower back, chances are you probably are pissed off that disc. You probably irritated that disc. Herniations happen all the time. It's nothing to be afraid of. It's when the disc ruptures is when we might have a problem. But herniations, those discs are very pliable. They come in and out of out of its place all the time. What do we do about it? That's the biggest thing. You can do non-surgical interventions, and that's what we do here. We work on making sure that you guys move better, so that way you guys continue to move for the rest of your life without going under the knife. What we want to do is we want to make sure that we stabilize your injuries when it's a low back injury like that. And it's simple isometric exercises, because as I said before, if you injure yourself, pain will decrease that awareness of that area. We want to bring back awareness. We want to remember where and how to move that area, so that way we can get back to living our daily life. Stabilize the injury. Don't stretch it. Don't roll it. Don't try to get a massage on it. Try to do some isometric exercises like I taught you here today. Thanks again, you guys. This is the Move Better channel. I am Dr. Joe. If you guys have any comments or have any other injuries that you guys have questions about that you want us to cover, be sure to put it in the comments section below. We'll be happy to help you guys out. Thanks, you guys.